let's jump right in. Hi, everyone. My name is Neha Singera, and I'm the Policy Director at the Berkeley Food Institute. BFI is a policy, research, and education institute housed in UC Berkeley. We leverage UC resources in partnership with communities to shape a just food and farming system. Today's webinar is the second in our spring webinar series, where we connect policy and research to explore timely issues shaping our food and farming system. Our webinar next month in April will focus on dry farming, and we'll be hearing from both a UC Berkeley researcher and a California farmer to learn about the latest advancements in dry farming in California's water-constrained farming context. The best way to stay up to date on the topics that we'll be covering in future webinars is to subscribe to the BFI newsletter, which you can do on our BFI website. And now for today's webinar on understanding the impacts of the cuts to SNAP and CalFresh in California based on the passage of HR 1. Our two panelists today are experts on this topic. We have Hilary Hoynes, who is the Chancellor's Professor of Economics and Public Policy at UC Berkeley. She also directs the Berkeley Opportunity Lab, and she's currently serving as the Associate Dean for the Berkeley Goldman School of Public Policy. Hilary is an economist who has worked on poverty, inequality, and the social safety net. Monica Saucedo is the Senior Policy Fellow at the California Center for Budget and Policy. She conducts research on public policies related to the social safety net and their effect on Californians with low incomes. The goal of her work is to promote equity in policymaking through robust research and build systems that improve the welfare of marginalized communities. Thank you, Monica, and thank you, Hilary, for joining us and supporting the BFI webinar series. We're thrilled to have you today. And before we jump in, a quick note to our audience, we are going to have a 10-minute Q&A at the end of this webinar, so feel free to submit your questions using the Q&A function at the bottom of your Zoom screen, and you can submit your questions while the webinar is going on. You don't need to wait until the end of the webinar to start typing in your questions. And we're also going to be recording today's webinar, so if you'd like to refer back to something that was said or pass this along to someone who wasn't able to make it, the recording will be available on BFI's YouTube channel. Great, so let's dive right in and begin the conversation with some foundational context and information to help frame today's discussion. I'd like to start with Hilary here. Hilary, can you please give us an overview of SNAP and CalFresh and explain where these programs sit and the role that they play in the social safety net that we offer?
Yes, I would be delighted to do that. I've got a few slides to carry this conversation along. First, let me just say thank you so much for having me. It's just a delight to be here talking about CalFresh and SNAP and to be here with Monica. Monica and I go way back. Monica was actually a PhD student of mine at Berkeley, and in full disclosure, I sit on the board of the Cal Budget Center, of which I am a huge fan. So I'm just delighted to be here today. So let me start by giving some context for the SNAP program. So in my mind, the SNAP program sits as being something as close to the fundamental safety net in America that we have. And so let me tell you a bit about it. It's a means-tested program, which means that families and individuals are eligible if they meet an income and sometimes asset tests, as well as sometimes other criteria. Benefits allow recipients to buy a wide range of food at all stores that are authorized to accept SNAP benefits, which today are dispersed via EBT cards. And nationally, in the last year that we have full data for, SNAP served about 42 million people at a cost of about a little over $100 billion. Thinking about how large SNAP benefits are for individual recipients and families, the average monthly benefit across all kinds of families and family sizes average about $188 per person per month, or about $6 per person per day. SNAP, this is really central. SNAP is a federal program The eligibility and benefit criteria are set federally, and the program is quite consistent across states. So even though food may be more expensive in some states than others, the basic SNAP benefit and the eligibility criteria are the same across all states in the United States. And the USDA, historically, and prior to HR 1, has paid the entire benefit payments for all states, and the administrative costs of the program are shared between the state and the federal government 50-50, and that's the only cost that the state incurs to participate in SNAP. We will be talking about time limits and work requirements. And just to point out that prior to HR 1, ABODs, so our able-bodied and without dependents, ages 18 to 54, are under pre-HR 1 law subject to some time limits that Monica will tell you more about. So now what about California? So we're here to talk about California, and the SNAP program is called CalFresh here in California. In 2024, SNAP served about 5.4 million California residents, or about 14% of the state population. And you can see that in terms of who receives SNAP, you can see that in California, like the rest of the country, an enormous amount of the participants in SNAP are children. So the modal SNAP household has children in it. So more than 55% of SNAP recipients in California are in families with children. And we have about 36% of Californian SNAP participants who are in families with members who are either elders or who are classified as disabled. And more than 30% are in working families. So SNAP is serving a wide range of individuals in California and across the country. You can see a little bit more detail on this slide. So critically, SNAP, one of the reasons why I think it's so central in our safety net, as a scholar of the safety net who also studies SNAP, is that it is a program that is available to both people the non-working poor as well as the working poor. And so you can see from the figure on the left, from the Center for Budget and Policy Priorities, that fully 40% of SNAP recipients, this data is for the most recent year, it's a few years old, live in families with income below 50% of the poverty line. So we tend to term this extreme poverty or deep poverty in the United States. And another third are approximately have income above 50%, but below the poverty level. But indeed, another third or so have incomes above the poverty level. So this is a way of kind of showing that SNAP is reaching not only the poorest Californians or folks in the United States, but also because of how the program is structured, it actually is a program that's really important for topping up low-wage work in families where incomes don't rise much above the poverty level. You can see in the figure on the right how the benefit levels vary in California across families of different sorts. So families with children versus families that have older adults in them and disabled individuals. The main thing that drives these differences in benefit payments across families is the size of the family. And so not surprisingly then, households with children tend to be larger and the benefit payments average a bit more than in other types of families. And then finally, a really important characteristic about CalFresh in particular, but this is true nationally, is that it lifts a lot of people out of poverty. So PPIC's calculations indicate that CalFresh lifts 600,000 Californians out of poverty. So it's really central. So let me finish my introductory comments by sort of trying to articulate why I think SNAP is so central in our system of supports in the United States. And so the first reason really just reiterates what I've already said, and that is it is the closest thing to a universally accessible benefit for the low-income population in America, although Medicaid is really kind of catching up in that regard. That is, we have other very important anti-poverty programs like the Earned Income Tax Credit. But essentially, you need to have children to get much of a benefit from that program. And you also need to be of working age and earning and those things. So SNAP has historically really reached working and non-working, families with elders, families with children, and people in different demographic groups. So that's the first thing. The second thing is, as I already said, it's an enormous anti-poverty machine, SNAP is. It is the second largest anti-poverty program that America has for children. Our largest anti-poverty programs in America, this is true in California and across the nation, are the tax credit programs, the Earned Income Tax Credit and the Child Tax Credit. And right after that comes SNAP. And the same thing is true for elders. The largest anti-poverty program in America for elders is Social Security, and the second largest is SNAP. So it's really central in aiding low-income population in the United States. Third, SNAP is a robust automatic stabilizer. And what automatic stabilizer means is that when we experience a labor market shock, a recession, increases in employment, reduction in work, SNAP, because it's an entitlement, automatically expands as income goes down, more people become eligible and they take up SNAP. We see that in recessions. We saw that most recently in the pandemic recession. And because it's an entitlement, it's going to serve people in a time of need with no action by Congress. And that's both good for the families and individuals who need access to SNAP, but it's also important kind of from a macroeconomic standpoint, because what we want to do is to try to increase demand when we're in recessions. And by having more purchasing power in people's pockets, we do, in fact, increase demand. And then finally, it's very easy to use. The food vouchers, SNAP through EBT cards are available across most stores, large and small, in California and across the country. And it's very sort of hassle-free for families to take these benefits and make them, put them to use in their family. So I will leave it there, and I look forward to talking more.
Thank you, Hilary, for giving us this overview of SNAP and also helping us understand the context in which it's operating and supporting families in the social safety net. I'd now like to turn it over to Monica. So Monica, can you please give us an overview of HR 1 as well as touch upon how it might impact California with respect to both the state budget as well as essential programs like SNAP, CalFresh in California?
Yeah, absolutely. Thank you. I'm going to share my screen for some slides to just ground us in this conversation. And thank you so much for having me. I think this is our the first time the Budget Center joins BFI. So really excited to be in this new space and really excited to join Hilary in conversation, who I've learned so much from and admire so much and continue to learn from. So with that said, let's dive into some not so fun topics here. I'll cover HR 1 and then really drill down on CalFresh in just a moment. So just to provide a high-level overview, HR 1 was a federal budget package that was signed into law on July 4th of 2025. And this package included the most significant federal cuts to healthcare and food assistance that we have ever seen. At a national level, the historic cuts to the Medicaid program and the ACA marketplaces total about $1.1 trillion over the course of 10 years, and $187 billion for SNAP, which is about 20% of the entire program's budget that was slashed. All of this while giving away tax breaks to the ultra wealthy that total about $1.4 trillion. HR 1 was designed to make permanent tax cuts from the Tax Cuts and Jobs Act from 2017, and to pay for this, we are seeing these major cuts to core safety net programs. So why is this important? Of course, as Hilary mentioned, SNAP is a core safety net program that serves millions of people, as is Medicaid, but it's also important because federal dollars help support and pay for major services and programs in California through the state budget. So federal funds account for over a third of California's budget. Therefore, cuts of this magnitude will cost the state billions of dollars over the course of 10 years. So this is data from the governor's recent proposed budget for 2026-27. And all of the cuts included in H.R. 1 are designed in ways that will disproportionately affect low-income families, immigrants, and communities of color. Specifically, data from the California's Department of Social Services and the Department of Finance estimate that up to 2 million Californians could lose their Medi-Cal coverage, as Medicaid is known in California, and the state could lose tens of billions of dollars in federal funding each year. And on the CalFresh side, over 3 million California households are poised to lose some or all of their assistance. So this is virtually all CalFresh households. And in total, the cuts to SNAP are estimated to cost the state between $2.3 billion and $5.1 billion annually. On tax cuts in California, the top 1% will receive an average annual tax cut of $35,000, while the bottom 20% of the income distribution, who will also be the group that is most impacted by the cuts to Medicaid and CalFresh, will receive about $100. So just to put that into perspective. So all of this to say that the state, as it is now, and because the state's budget needs to be balanced, it does not have enough money to cover all of the federal dollars that are going away. Without any new or ongoing state revenue, California leaders will have to make really difficult decisions about where to pull money from if they wanted to cover the federal dollars that are going away, which I think we'll get into a little bit more later. So now I want to spend a little bit of time just highlighting the changes to the CalFresh program introduced by H.R. 1. So here you'll see the various eligibility restrictions introduced via H.R. 1. So namely, H.R. 1 blocks several categories of humanitarian immigrants from enrolling in SNAP. So I want to be clear that federal SNAP does not and has not covered undocumented immigrants in the past. These are non-citizens who are legally present. And this would mean that about 72,000 refugees, asylees, and other lawfully present immigrants would no longer be eligible for federally funded CalFresh when this provision goes into effect in April, so next month. It's expected that once it does get implemented, when people apply or have to be recertified for SNAP benefits, they would be denied. Additionally, H.R. 1 expands the CalFresh program's time limits that Hilary spoke about. These are enforced via work reporting requirements and limit assistance to 3 months over a 3-year period. So this H.R. 1 expanded the age of adults that would be subject to these time limits up to the age of 64, and for the first time now includes parents of minors. So anybody that has a child whose youngest child is 14 or older would also be subject to the time limits. H.R. 1 also explicitly removed previous exemptions that were targeted toward veterans, former foster youth, and people experiencing homelessness. These were introduced in 2023, recognizing that these populations often experience unique challenges in the labor force. So H.R. 1 has now eliminated those exemptions. Furthermore, H.R. 1 also limits the areas which can be exempted from applying time limits to areas with unemployment rates over 10%. So previously, California had a statewide waiver, and I think this was in place for, over a decade, with maybe a few counties being eligible and some others throughout the years. But virtually the entire state had a full waiver for applying time limits. And now that these changes have come into play, only 7 counties in California would be deemed eligible. The previous criteria allowed counties to be exempted, recognizing when there was limited job availability rather than just capturing unemployment rates. So these are several other changes introduced by HR 1. I won't go into every single one. In total, there's about 9 or 10, depending on how you slice the different changes to CalFresh via HR 1. But here we have changes that will hit the state budget a little bit more directly, and I want to draw your attention to the first two. So starting in October of 2027, California will be required to pay for a portion of CalFresh benefits using state dollars. And this is a major departure from how the program has been previously administered, where benefits were 100% federally funded. Also, the state will be on the hook for paying a much larger portion of CalFresh administrative costs, which was previously shared 50-50. The state would now be responsible for 75% of costs, and this would add approximately $650 million to current administrative spending for the state. Then there are other restrictions that include freezing benefit levels, which will ultimately reduce every single household's monthly assistance due to food inflation levels, as well as changing some of the ways that utilities are counted for benefit determination. So there's definitely a lot to unpack here. I'll turn it back to Neha to dig in a little bit deeper.
Wow, thank you, Monica. That was a lot of information and a lot of data and numbers. I'm just trying to sit with everything that you just shared, especially with your estimates of how many Californians could lose their CalFresh, lose a portion or all of their CalFresh benefits, and the changes of eligibility and access that we're also going to be seeing. So Hilary, could you help us understand what the research tells us about what we might expect to see with these changes that Monica mentions? What can we predict about the impact to families as well?
Yes. There is an enormous amount of incredibly high quality research about what SNAP does. We know a lot about SNAP, which is really important. SNAP has been universally available in the United States since 1975. And given its sort of core element in our social safety net, there's just been an enormous amount of research from people coming more from a public health standpoint to health policy experts, economists, public policy folks, sociologists kind of trying to understand the mechanism by which people end up on SNAP or not. So we know a lot. And I guess kind of on a big picture sense, some of the things that have been studied the most about SNAP over the decades are the things that we would think are kind of most proximate to what SNAP is. And that is, we know that when families and individuals receive SNAP, they spend a lot more on food. That is not surprising. It should be like self-evident that that would be true. But in fact, you see it translating into a lot more money being spent on food. And probably the thing that maybe has been studied the most, and again is sort of most proximate to what we think of as SNAP, is that there's just a powerful range of research that shows that when folks get SNAP or SNAP benefits get more generous, many different ways of kind of capturing this, we see food insecurity decrease. And food insecurity is this kind of critical measure of having access to food that we know from other research has strong negative consequences for health, economic well-being, both in the short, medium, and long term. And so kind of the first thing to say is we've got a lot of evidence that in this very kind of tight connection between receiving SNAP benefits, purchasing food, and food insecurity, we've got a very strong chain. After that, there's a very wide range of things that people have studied that I would say are mostly downstream of those kinds of things. So for example, when families have access to SNAP, children are less likely to be absent at school. When families have more access to SNAP, particularly over many years in a row, we tend to see somewhat better health among children. Access to SNAP, we see that within a month, oftentimes families run out of SNAP by the end of the month. It's what's often referred to as the SNAP benefit cycle. We see near the end of the month more children showing up with like disciplinary actions in schools, just a marker of stress that you might say is like the opposite side of what SNAP does. And we also see that as children have access to SNAP in childhood, they tend to be have much higher well-being in adulthood. So particularly having access to SNAP in early childhood, some work that I've done shows that children are more likely to graduate high school, go to college, earn more, be less likely to be poor in adulthood, be less likely to be connected to the criminal justice system, live in a better neighborhood, just a very wide range of improvement in material conditions and health. And so we generally see a strong amount of, just like wide set of benefits for SNAP. Any one outcome in particular isn't transformative, but it's wide and it reaches a lot of people. So it adds up to an awful lot of improvement in outcomes. And so that's kind of in short what we know. Now, turning to, I think in a broad way, any reduction in SNAP benefits is going to make all those benefits decline. So kind of in short, less access to SNAP means less benefits across that range. One detail that I want to add before talking about time limits and work requirements, because this is really important. Our main way of measuring food insecurity is through a USDA annual survey called the Food Security Supplement, which is every December is out in the field and asking people a set of questions for measuring food insecurity. And perhaps many people on this BFI call will be familiar with how we measure food insecurity in America. Well, unfortunately, last fall, USDA discontinued funding the food security survey. So our main federal statistic for doing surveillance on this central and most proximate outcome has been eliminated. And the good news of that is that we know how to measure food insecurity, and there's a lot of folks out there who are, popping up surveys in order to try to fill that space. But that's quite an unfortunate discontinuation of something that's so key for us tracking the surveillance of such a critical national statistic, as we call it. So turning to the time limits and the work requirements, as Monica said, we have had this system of having some work requirements for these ABODs in the SNAP program for many years. And so we know something about what they do. And actually, my colleague at the Goldman School, Adam Levy, and his co-authors have what I think is the clearest evidence about what work requirements do. And their analysis is quite a simple one. The current law prior to HR 1 about work requirements has this age range. At the time they did their study, it was, I believe, 18 to 49-year-olds were subject to these 3-month time limits. And so what they did was use an approach that we call a regression discontinuity approach that compares people who were a bit younger than 50 to those that are a bit older than 50. And given that, that's kind of not that different, whether you're 49 or 51, they essentially compare outcomes in a population that has access to SNAP fully versus the population that is facing these work requirements. And they then study their outcomes as people kind of age into these work requirements. And what they see is extremely striking and quite troubling. What they see, number one, is that folks subject to work requirements do not increase work. There is a baseline level of work that's very high among SNAP recipients, and whether or not you face this time limit or not, your work levels are the same. However, when you face the time limit, a large share of recipients end up no longer on SNAP. And so the way that we interpret this is that these aren't really work requirements, but they're paperwork requirements. In other words, the recipient needs to document that they're working at a certain level. That means a lot of paperwork in order to do that. And these work requirements are often set on how many hours you have to work per month. And I don't know about the rest of you, but my paycheck does not have hours on it. It only has pay. And so it turns out like it's a big burden to try to report these things and stay compliant. And so I think what we know about work requirements is that they don't change work, but they do in fact lead to fewer people having access to the program. And so that's sort of the core element that's at the prediction that Monica talked about how many people we're expecting to be that could be at risk of losing access to SNAP, not because they're not meeting the work requirements, because they are not able to get over the threshold to do the reporting in time.
Thank you, Hilary. That was really helpful, and that your remarks just now also have sparked a bunch of questions in our chat. So I did want to pause and take a quick moment to follow up quickly on two things that you mentioned. One is, so you had mentioned that the USDA has discontinued that federal food insecurity survey. Do you by chance know if there are legislators in California, advocate groups running a version of that type of food insecurity survey? Is that a bill being proposed in the state of California? And do you also have thoughts on the pros and cons of having this effort being state-led versus federally led?
I will see whether I don't know of anything happening at the state level.
Yeah.
However, I do know that one of the surveys that the good thing is, like, measuring food insecurity is not that difficult. It depends, there's a short version and a longer version. It's either like 4 questions or 10 questions. It's a doable thing, and we know what it is. So in principle, it's easy, or, obviously it costs something to do this, but in principle, we know what to do to kind of add it into a survey. So I was at a conference last fall where I was part of a panel, and we were sort of talking about this, and I learned a lot in that panel about what people are thinking about. So for example, the California Health Interview Survey, which is a very large survey of Californians that measures basic health kinds of things, folks had talked about adding it to that, but I don't know the status of that. So that's the only California specific conversation that I know is happening. But I do know that it's something that a lot of people are talking about. I've been more in national conversations, and I don't know as much about what's happening in California. Monica might be able to add something to this.
Yeah, happy to quickly jump in. There is a bill, I believe, introduced by the SF Marin Food Bank as sponsors, and I think it's AB 1734, but please don't quote me on that one. And it is to actually expand the CHIS, the California Health Interview Survey, to address this. So the California Health Interview Survey plays such an important role in documenting California's specific food insecurity, but they are limited as to who these questions are posed to people under a certain poverty level. So it doesn't quite replace the national survey, and this bill would provide extra funding for them to expand the survey, but again, it may not necessarily fully serve as a replacement. And the only thing I'll add is that while we do think it's super important to collect that California data, it's also really important to have a national baseline to understand how California is doing.
Absolutely. That's a great point.
Yeah, thank you both for answering that question. We have additional great questions in the chat, but we do have to return to the main programming. So I will turn it to Monica and ask Monica, you mentioned at a high level what the impacts to the state budget can be, and there was a lot of numbers and data and figures in your slide that you shared. So I'm wondering now, can you share a little bit more in depth on what we can expect in the state budget with these changes?
Yeah, absolutely. So I alluded to this in my slide deck, but there are 2 major changes that will hit the state budget directly. So the first one is that the state will have to pay for a portion of CalFresh benefits for the first time in the program's history. So what this puts California on the hook for, based on recent data, is about $2 billion per year. And this calculation is based on what is called the payment error rate. And a state's payment error rate measures the accuracy of the state's eligibility and benefit determination. So if someone gets a little bit more money, or they get an underpayment, less money than what they should qualify for, they would be docked a point in their payment error rate. So I want to be super clear that this is not a measure of fraud. This is typically a measure of incomplete information either by the county worker, they don't have all of the information, all of the income sources documented, or something changes in the family side. And something gets lost in translation. So this is really punishing the states for making errors when there are already protocols in place to rectify those errors. So California, post-pandemic, a lot of states experienced an increased payment error rate because there were a lot of changes due to pandemic era policy. And California's current payment error rate is about 10.98%, which is right in line with the average for the at a national level. But this puts California in the highest category of what they would have to pay for in terms of benefits. So 15% if they continue to fund everybody that is currently on CalFresh. What's important here is that this is a requirement and it's an unfunded mandate. States either have to pay this money or opt out of the program. If California were to choose and say, actually, we can't afford this, we're only going to pay $1 billion, the federal share of benefits would decrease proportionally. And it's really challenging because, as Hilary mentioned, SNAP is an entitlement program. California can't decide, we're actually only going to pay people 50% of their benefits. It doesn't work that way. So it's a huge hit on the state budget. And it's not money that is laying around on the state budget, in the state budget. And additionally, the other piece of this is the administrative costs. So I mentioned that this is about $650 million, although I think recent estimates put it upwards of $700 million. And this is a cost that is shared between the state and counties. And again, unfunded mandate, there really isn't a way to opt out or change this. And it really, what it does, it limits the state's ability to respond during recessions because states have to balance their budget. They can't print money. So if there is an increased need, that means that they are on the hook for a much larger percentage and dollar amount. So those are kind of like the main ways that the state budget will be impacted.
If I could just add to Monica's excellent summary of this error rates, this is a little bit in the weeds, but these error rates, first of all, are very low in SNAP. That's one. Number two, error rates can be positive or negative. They can be that everything is fine, but there's a signature missing. I mean, it is a very wide range of things that are called error rates. And the most important that I'm only learning about now, like I knew about error rates, but there's a lot more work going on right now to understand it because the stakes are so high for states, is that the USDA calculates error rates based on what is a very small sample of state records where basically they have a second person go over. It's like an audit. You go over and check the work of the caseworker. And it can be as low as 300 cases per state per year. So basic statistics will tell you that could lead to a lot of variation. And I think there's going to be a study that's released soon from Brookings Hamilton Project that just tries to look at historical error rates to show how much year-to-year variation there is, which is mostly because these sample sizes are so low. So to me, that says that this statistic is just not ready to be so important, like to have so many billions of dollars riding on it for something that's measured so imprecisely.
Thank you, Hilary, for adding a little bit more context to what Monica was sharing. That is incredibly interesting to learn the sample size. Monica, maybe turning back to you. So you shared a little bit about what we can expect in terms of impacts to the state budget. And now I want to ask you, how is the state of California responding? And when do these responses kind of need to go into effect? Like, when are we going to see the impacts to the budget take place? And also, what's the role of city and county local governments who are also going to see these impacts come through their offices, and what types of responses can they have?
Thank you for that question. That's really important. So while we're on the subject of error rates, I'll start there because these are kind of the pieces that, while the payment doesn't go into effect until October of 2027, the amount that California would be subject to pay is based on error rates from fiscal year 25 and 26, which we currently are in. So changes needed to happen now, yesterday. And with that said, late last summer, after the budget was already signed, legislators came back together to try to begin to fund strategies that would help reduce the payment error rate. So post budget, there was a budget bill junior, so an amendment to the budget package that approved a total of $143.6 million. And this was spread out to supplement funding for food banks. It also was money designed to go straight to the Department of Social Services for HR1 implementation that included things like automation costs, training for staff, and it was really kind of like a way for the department to try to assess how they could begin to implement these changes. Now I'll say that number again, $143.6 million. It's a large number, but it's not really that large when we're talking about everything that is going into effect, right? And in fact, in this year, every January, the governor releases his proposed budget to kind of give the legislature a chance to see where his mind is at for the budget package. And it did not allocate any additional funding, no more funding for food banks, no more augmented funding, I should say, for food banks or any other amount to supplement what was approved last year. The only thing that was included was the administrative expenses cost that is required by HR1 to be paid starting this October. So there is a lot of conversation right now in the legislature. They're right in the middle of budget season, having hearings pre what is called May of Revision, which is the governor's second release of what his budget proposal is. There's a lot of hearings happening right now, and we're learning a lot from both the Department of Social Services and from counties about what the need is going to be to actually implement a lot of these changes. So we'll speak a little bit about what counties are up against now. So I mentioned that counties will have to also pay a portion of those augmented administrative expenses. Counties are a little bit more limited than the state is as far as their budget and how they can raise revenue. Mostly through fines and fees and things like that, or sales tax, which tend to be regressive tax measures. So that's one thing to point out. Counties are also at the front line of actually implementing these changes. County workers are the ones seeing the people, screening people, and also changing the way they do their work. So as I mentioned before, particularly with the time limit statewide waiver, county workers had not had to do such a deep screening of folks in many years. So there's a lot of training that needs to go into this. And in fact, the County Welfare Directors Association estimates that they'll need about $11.1 million this fiscal year, so 25-26, and $114 million next year in order to properly scale, prepare, train, and resource those county eligibility workers. So putting that into context with what was approved last year, we're really, it's much less and not going to go as far thinking about what is actually needed in order to make sure that all of these pieces of HR1 are implemented correctly, because again, they need to be in order to try to reduce that payment error rate. So errors are very, the stakes are really high for implementing all of these changes correctly, and all of them are coming into effect at a similar time, coupled with a lot of changes in Medicaid. So there's a lot riding on county workers at this point.
Thank you, Monica. For this final question, I will invite both Monica and Hilary to respond. So you've laid out a little bit of the groundwork and the timeline and the budget estimates of how the state budget and county budgets and county workers will be impacted. Now can we focus a little bit on what can be done to mitigate harm at the state level, at the local government level? And we also have a question in the chat that's inquiring about food banks and food pantries, as well as nonprofits that may be in a position to build resiliency to support the anticipated increases in the need for food. So I invite both of you to respond to these questions about how to help mitigate the harm that we will be expecting.
I'll kick it off. I think that to speak to what the state can do, and honestly what it's already doing, I think, is Circling back to the research on what we know from existing time limits and work requirements, as being a situation in which these new kind of paperwork requirements are what can often get in the way of folks remaining eligible. And so I think that many states, including California, are thinking about ways to use the data they have to sort of pre-certify who looks to be working, given the data that they have access to. So instead of putting all the theory of the cases, instead of putting all the responsibility on the CalFresh recipient, can the program providers, using the data that's available to them, determine who is already meeting the work requirements, so that they can sort of focus their efforts on more intensely on the population that looks like it might be more difficult to make sure they have their paperwork done. So I think there's a lot of interest right now in how to use data assets that the state has in order to try to, basically do more pre-certification, would be the theory. And I will, I'm very interested in hearing what Monica might have to say about food banks, especially given she's got a lot of expertise in that area. But the one thing I would just sort of tee up from the context of food banks is they are the front line. In a way that is much more frontline than SNAP, because it's just kind of open access in your community. And the food banks have really been under a lot of stress in the last 5 years, starting with, of course, the COVID pandemic, but then more recently, the government shutdown of last year generated an enormous amount of stress in the food banks because people weren't getting their SNAP benefits. And then further, around the same time period, we had what many term the benefit cliff. When the last of the expansions to SNAP that occurred as part of the pandemic assistance went away, people's SNAP benefits dramatically went down. And so all of these things have led to a setting in which food banks have really been under a lot of stress to serve. And so I think we have every expectation that their stress is going to continue as these HR1 policy changes come into effect.
Thanks, Hilary. That was really important context, and I think I'll echo what Hilary said on food banks. Food banks are really important, and the California Association of Food Banks, along with food bank partners, are asking for augmented funding. However, they recognize as well that their dollars do not stretch as far as CalFresh dollars. They are far more limited in their resources, both in terms of what they can administer. They oftentimes depend on volunteers. They have limited storage, things like that, whereas an EBT card is much more accessible to families to go into a store. So while they are a really important resource in our communities, they are not a replacement for CalFresh benefits. With that said, additional things that the state can look into, I think that the state is all the conversations happening in hearings that we're hearing from CDSS, the Department of Social Services, there is a lot of intention in trying to implement these changes in a way that mitigate harm, that uses shared data, that screens people in a way that ensures they are not being kicked off just due to missing a piece of paper, things like that. But all of this requires a lot more time, a lot of more resources, and really, really deep investments. And I said from the beginning of my presentation, the state is not in a position to backfill these federal cuts. As it is now, we are facing deficits in the out-year budget years, and the state budget needs to be balanced. So it really is important for state leaders to consider all possible solutions, including raising revenues, particularly because HR1 was really designed as a resource transfer toward wealthy families and corporations. And it's really important now to ensure that that money is staying where it's going to help the most people and ensure that people are able to reap the benefits of food security that we have talked about today.
Monica, do you know whether Is USDA made any changes to the money that they send out to the states that fund the food banks through the TFAP program? Has that changed, or that wasn't part of any changes in HR1, was it?
Not that I'm aware of, but California depends primarily on the Cal Food program more than TFAP, which is to buy locally grown food in California. So that is a much larger part of their budget. And in fact, the Cal Food program, its baseline funding is $8 million. And this year, without further
Wow.
augmentation, would revert back to that. It has been previously augmented up to 60 million in previous years following the pandemic. So we could see a giant cliff also with food bank funding is not augmented in this year's budget.
Thanks for that question, Hilary. And I believe that there's also a bill making its way through the session right now that would be funding the local food purchasing assistance program as well, which also supports food banks in California with California grown produce. Okay, so we're in the final 10 minutes of our webinar. I'd like to start the Q&A session. So I see a few questions in the chat, but if folks have other questions, please do type those in using the Q&A feature at the bottom of your Zoom screen. So I'm seeing one question here related to summer EBT. I think the question is just asking, how is summer EBT going to be affected by HR1? As well as just what, school meals, which are now universal in California. What does the summer school meal offering look like, and how does that kind of play into summer EBT benefits?
I think that what I'm pulling out from that Q&A is an important aspect that I haven't given quite enough thought, but there's a lot of programs in America. We're classically a country that serves the low-income population with a lot of programs, patchwork. And one of the things that we have is what's called direct certification, which is to say, in this context, the relevance is if you lose your eligibility for SNAP, that means that you could lose your eligibility directly because having SNAP, being on SNAP can automatically authorize you for access to other benefits. And so I think that the summer EBT program would be an example of that. I think you could still go through the process of gaining eligibility for the summer EBT program, which for those who aren't in the know, is really trying to help children over the summer when they're not getting meals at school during the school year. And so there's a lot of feeding sites, including at schools, that serve the community in the summertime. So I think that the concern is a relevant one, that by losing SNAP, you could lose access, not categorically, but you'd have to jump through more hoops to maintain access in other programs. So there may be other important things to pull out there, but that's the thing I wanted to highlight.
I think that's a really important piece. I think the only thing I'll add, and I didn't spend too much time on this provision, but HR1 also freezes the adjustment of the Thrifty Food Plan, and benefit levels for summer EBT are also tied to the Thrifty Food Plan. So if those levels are not able to be adjusted, if food prices are increasing, we will also see an effective reduction. So dollars not going as far for summer EBT. And the other thing I'll add, this direct certification also impacts, while school meals are universal in California, they're not, not all of them are being reimbursed by the federal government.
Right.
So it does put additional pressure on the state budget if children are not eligible through the federal reimbursement.
Right.
Yeah, Monica, thank you for that distinction. And it does, Kat also mentioned in the Q&A, school meal applications are still required despite universal free meals. So that does, it is an interesting point to bring up related to categorical eligibility or reciprocity between various programs. Thank you for that really important question.
Right. And that point, Kat's point, is exactly right. And it's about the federal funds coming to reimburse the state. And if you're a SNAP recipient and you're therefore eligible for free meals, you get a higher reimbursement rate than if you're higher income. And so that's an important element. I'm glad that Kat raised that.
Yeah. I see a few more questions coming in. We have one from Anna Alicia, who's with the Los Angeles Food Policy Council. The spending of SNAP dollars is an important economic contribution with fewer SNAP dollars circulating in our local economies. Can we, we expect this impact to be felt among retailers and producers. So the question is, are there any initiatives focused on supporting other supply chain partners as cuts to SNAP will be felt broadly? And I think maybe if I may add to that question, which I think is a really good one, do we also know what we can expect in terms of impacts to grocery retailers, particularly serving communities with a high proportion of families being served by SNAP?
The one thing I would want to lift up on this comment, which is a really good one, is that food retailers know that SNAP is good for them. And in fact, I think one of the, not the main, but one of the reasons why SNAP has been so resilient all these years when so many other programs have been reformed in the past decades is because there's this separate, not lobby for the low income population that advocates for SNAP. And that's a very powerful kind of grocers association. Now, they didn't stop HR1 from cutting back on SNAP, but it is just useful to point out that that's kind of an interesting kind of political economy that links kind of advocates for the low income population with another kind of community. So I just wanted to kind of lift that up, but I don't know anything specific about this. Monica may know more than I do.
I'm not too familiar with this issue, and thank you, Hilary. I think that's a really important point. I know there was research by the National Grocers Association over the summer when this was all being discussed that show more direct, their estimates on impact, but I haven't kept up with that as much. As far as state initiatives, there's a CalFresh fruit and vegetable pilot. So this is a pilot program that is actually set to end soon that allows people to use their CalFresh dollars and gives them it's a matching program, so it matches their CalFresh dollars for them to spend on at farmers markets on fruits and vegetables. So if there's an initiative to try to grow that pilot program and extend it, so that might be something to follow up with. And then additionally, as I mentioned, the Cal Food program, which helps fund food banks, but it is also money that it's to pay for California grown food, so it also goes to California farmers. That is another really important piece of this.
Wonderful. Thank you, Anna Alicia, for that question. We are at time, folks, so appreciate all the participants who've joined today, and thank you for tuning in, and thank you, Monica and Hilary, for sharing your expertise with us. I certainly learned so much from this conversation. And just as a reminder, a recording of this webinar will be put on BFI's YouTube channel, and it will be closed captioned as well. Thank you, everyone, and we will see you next month on the BFI webinar series. Bye.
Bye, thank you.